welcome. OET speaking. I'm not coming to the usual rules. Quick recap. You marked on your language skills, which is your skill to talk fluently, not too fast, not too slow, but have the right pace. Clinical skills, you have to be really patient. You have to answer all the bullet points, not even miss one task. Try to rephrase what you can, and then be very polite before getting the information, after getting the information. Can I? And after once you get the information from the patient, you say thank you. Then the warm-up session, the speaking subtest has a total of 20 minutes. You start with the warm-up session where they will ask you about 5 to 6 questions regarding your profession, why you took nursing. In fact, we discussed all the questions earlier, isn't it, students? Yeah. And then, but you're not marked on the warm-up session. But still, I say you should study the warm-up session questions because you start off with the warm-up, isn't it? So if you talk confidently, you can be confident throughout the session. You'll be happy and you'll talk. That will be a big motivation for you. Then you'll be given 2 role plays. Before each role play, you'll be given 3 minutes to prepare. So what do you do at the time of the preparation time? When you get the question paper, what do? You can use a pencil and mark down the important points. And after listing the important points, you just mark down everything on the paper. And then you can ask the examiner, how can I address you during the role play? I would say, even if it's a known case or an unknown case, ask the patient. Ask the examiner what their name is, okay? Yeah. So what is a known case? Known case is when you know the patient in advance. Already you are in touch with the patient. You know the condition of the patient. Example, when the setting is in a hospital ward, house visit, when you're doing multiple visits for the patient. Then what else? Tell me, students, can you tell me some other examples of known cases?
Inpatient.
Yeah, inpatient.
Hospital ward.
Yeah, hospital ward I said earlier. Yeah. So these are some of the instances when it's a known case. So definitely you have to ask the patient, the examiner, how can I address you during the role play? Because straight away you can start with the dialogue, with the name, using the name, because you already know the patient in advance, isn't it? If it's an unknown case, can you tell me what are the examples of an unknown setting? Tell me.
Community clinic.
Emergency department.
Emergency department.
Yeah, you all said outpatient clinic, when the patient is coming to get some information about something. Okay. Outpatient, when the patient is coming to visit the clinic for the first time. Then emergency
home visit.
What? Yeah, first home visit, suburban clinic. So all these settings you may see. So at that time, what you do? I'll give you 2 options. One is during the preparation time, you can ask, how can I address you during the role play? Do you understand?
Yes.
Even if you ask during the preparation time, since you don't know the patient before, when you begin the role play, you should ask, can you restate your name, please? Why? Because you don't know the patient, isn't it? So once again, you can ask, can you restate your name, please? This is the first option. The second option is, you need not ask the patient or the examiner the name during the preparation time. Instead, you can straight away ask when you begin the role play, can you state your name for the record, please? Then don't say restate. You say restate when you ask for a second time, isn't it? Did you all understand?
Yes, ma'am. Yes.
Yeah. So for the newcomers, I think that will be useful. And then you start off. See, for the exam, it is the candidate who needs to start the dialogue. It is not the examiner. And as we all know that nowadays the tasks are very long, but you'll be supported with a lot of bullet points. Remember, don't read out the bullet points comma by comma, but instead try to build up each bullet point. That is very important. Try not to miss any point because everything is important. And if possible, if you think you can rephrase it, try. And then once where you finish the 2 role plays, it should be about 20 minutes or a little more, but that doesn't matter. Always learn when you begin the role play, start in a very smart way and also end it in a very, you wind up smoothly. Don't give an abrupt ending. Okay. Don't stop all of a sudden. That is what I meant. These are the usual things. These are on my earlier slides. If you want, you can have a look there. Actually, I'm not wasting the time repeating the same thing. I thought let's straight away go to the role play. If you all don't have it, can you all just take a screenshot of it? Students, you can take a picture. That'll be nice for you to follow. Okay?
Yes, ma'am.
This is a very small session, very close session, just our group. So I want everyone to participate. Don't be silent. Okay. Can one of you start with the setting till the background? Can one of you read? When you read, please remember to read loudly, but not very fast. You can read the nurse part, okay? Because I'm here to explain it first. The first round of session will be, I'm going to explain how we can build it up, and then we'll have a role play session. Yes.
Hospital ward, you see the parent of a 7-year-old girl who has just had her adenoids removed and is due to be discharged, and you see the parent to discuss his or her daughter's discharge and to answer the parent's questions. His or her daughter is not present.
Thank you. Yeah. So this is a setting of a hospital ward. So when you see the hospital ward, what do you understand? Is it a known case or an unknown case?
Known case.
Known
Yeah, known case. Good. See, now I'll just explain what the background is. You see, you here refers to the nurse, you, isn't it? You are seeing the parent. The parent refers to only one person. You see the parent of a 7-year-old girl. So actually, it's when you read the word parent, which means it's only one, either the mother or father, that you can decide, of a 7-year-old girl who has just had adenoids removed. So which means this girl, 7-year-old girl, just had finished the surgery and is due to discharge. Due to be discharged meaning will be discharged shortly. You see the parent. Now, why have you come here? To discuss his or her daughter's discharge and to answer the parent's question if they have any sort of question. Her daughter or his daughter is not present. So here, in such a role play, actually there are 2 characters involved. One is the child who is a patient and also the parent. But we know that the patient is very passive. The mother or the father should be the active person, isn't it? So how do you ask the name? I would say, since it's a known case, it is easy and less confusing if you ask, how can I address the child during the role play? If you want, please note it down. How can I address the child during the role play? Okay. Then, for example, if I say, Anu, you note it down on the question paper because otherwise you get confused with other names. Okay. Then when you begin, how do you ask? Good afternoon. I am Alice. Who is on duty today? I am Alice. Who is on duty today? Then you can ask like this. Am I talking to Anu's mom? Am I talking to Anu's mom? Or another option. Is it Anu's mother? I think that is less confusing because if you ask the name of the parent, the name of the child, Sometimes you can get confused with both the names and that can go crazy. So the safe side is just to ask the patient's name and then restate. Am I talking to the child's mother? That is enough. Yes or no? Students, what do you feel?
Yes, ma'am.
Yes, ma'am.
Yeah, I think that is better. Okay. So now, can one of you read the first task alone?
Confirm the daughter's readiness for the discharge. Post-operative recovery is satisfactory. Find out if the parent has any concern. Example, pain management, self-care after discharge, etc.
See, in this, thank you. In this task, we see there are two sub-questions, two parts. One is confirm the patient's readiness. Readiness, what do you mean by that? That you are confirming, you as a nurse is confirming that the daughter is ready for discharge. Why? The explanation is given in the brackets because her post-operative recovery is satisfactory, isn't it? Now come to the next task. One is when you're giving confirmation to the mother that the daughter is ready and her condition is fine. Next is find out if the patient has any concerns regarding her daughter's pain management or self-care after the discharge, isn't it? So you cannot, it's good if you build up in a sentence and help you, okay? If you want is ready for discharge. As, see, again, I'm going to read the bullet points, okay? As her post-operative recovery is quite satisfactory. See how I've built it up. This is how you need to build up the bullet points and the sentences, okay? And when you talk, don't give a dull voice. Instead, you should have a punch. Because remember, only your voice is recorded. So don't say in a very dull way. Instead, have the energy to talk like this. Well, I've come with the glad news that your daughter is ready for discharge. Because or as her post-operative recovery is quite satisfactory. Then come to the next task. It is find out, isn't it? So either you can begin like, do you have, or can I know if you have? Do you have any concerns regarding her pain management or care after discharge? Did everyone get this?
Yes, ma'am.
Then I'll give my answer saying that, I'm a bit worried because my daughter has a sore throat and her sound is as though she's speaking through her nose. So these are the worries of a parent, her mother. So definitely, what is the first thing that you have to do? You have to assure them, give them reassurance and only attend the task. Don't be in a hurry to attend the task. What do you say? Don't be upset. Or don't be overly concerned. We are here to help and support you. Then can someone read the next task?
Outline common temporary after effects of adenectomy, sore throat, earache, stiff jaw, change in voice, etc. Give details of recommended pain relief, over-the-counter painkillers, example, paracetamol, etc.
Okay. So here I have said my Vara. She's speaking through her nose and she's got a bad sore throat, isn't it? So you're going to tell me this outline, which means explain the common temporary after effects of adenectomy, which means you're going to explain that. See the brackets. Some of the symptoms are mentioned here. Sore throat, earache, all these are some of the common after effects after this procedure. So we are going to reassure them by saying that, so these are all temporary and there is nothing to be upset about. Okay. And then come to the next task where you say, give details of recommended pain relief. You can say, well, I would suggest some of the pain relief like paracetamol. Then give an explanation. Don't finish off by that. That will help. You have to be very, very explanatory. Okay. Now listen to how I'm going to present. See, when the mother says that I'm very upset because of my child's situation, how do you say? Don't be upset. Then you can begin like this. You said that your daughter has a sore throat and change in voice, isn't it? Let me explain. Some of the common temporary after effects of adenoidectomy are, use the bracket, sore throat, ear, and change in voice. They are temporary, and there is absolutely nothing to be overly concerned. By this, you're giving a reassurance, plus you're explaining that these are all the common symptoms. Then you can say, some of the recommended painkillers which are available over the counter, like paracetamol, will definitely use her pain. This is one way of saying, or you can say, well, I shall recommend some pain relief which are available over the counter that will definitely ease, EASC meaning reduce her pain. See, when I tell you a word like ease, if you find it difficult, please don't use it. Instead, you can say use reduce. Be comfortable when you say, okay, that is very important. Otherwise, there's a tendency for you to break in between, and then the whole thing will, the rhythm of the talk will fade away. So did you all understand how to address this task, everyone?
Yes.
You told me I shall give you some, I shall give your daughter some, I shall recommend her some to be very useful. So what is my answer? But I would like to know that my daughter is in liquid after this procedure. So I would like to know when she can start eating solid food. That is my other question. So what is your explanation for that? Read.
Advice for solid food. Recommendations or food types in the meantime. Example, easy to swallow, smooth texture, non-abrasive, etc.
Okay. So now I'll ask, when can she start on solid foods? You're giving me this, okay? Advise the time scale. Here, time scale refers to the time period for solid food. Then the next task is give recommendations on the types in the meantime. Here, in the meantime refers to what she can have for the first 3 days, because she can start solids only after 3 days, isn't it? In between, before the 3 days, what can she have? That is meant by in the meantime. So you can either say in between or now or in the meantime. You can use the same word also. Give her something that is easy to swallow, something that has a smooth texture, and something that is non-abrasive. Here means something that requires less grinding, chewing, something that is not really rough and hard. Okay, so I'm going to tell you how you can attempt this, okay? So I'm finishing off by saying that, oh, well, I don't know when she can start on solid food. So what do I do? So you can say, well, regarding her time period for solid food, please, I'm using Malayalam. Regarding her time period for solid food, she can start solids after 3 days. Please build it up in a sentence like this. Then, in the meantime, what do you mean in the meantime? Now, at present. In the meantime, you could give her something. Why am I using could? Because I'm giving some options which she can choose, isn't it? You could give her something that is easy to swallow, comma, something that has a smooth texture, which requires less grinding or chewing. Once again, I repeat, in the meantime, you could give her something that is easy to swallow, something that has a smooth texture, which requires less grinding or chewing. This is one way of saying, but doesn't matter that you should only say in this type, okay? You all are free to talk in your own way. I'm just giving you one help. So did you all understand this?
Yes,
Yes, ma'am.
Yes. Yeah. Then what's my doubt again? Then I'll say, okay, I follow your advice, but I want to know when my daughter can start school because she's missed a lot of classes. That is the mother's next worry, okay? So, in fact, I want my daughter, and I'm going to say, I don't want her to go behind school. So, I want my daughter to go back to school tomorrow itself. That is the mother's demand. Okay, that is what she plans. So, what is your answer for that? Please read the task.
Advice need for recovery at home. 1 week. Outline ways to reduce risk of infection. Example, avoidance of people with the coughs and colds, no swimming for 3 weeks, etc. Explore any other parent concerns, next step, etc.
Okay, thank you. So, actually, you as a nurse, do you agree that she can go to school tomorrow?
No.
Why? Because you know that it is written here that she requires 1 week of rest, isn't it?
Yes.
So the dialogue I end this like, see, I want her to go back to school tomorrow. Then, since you don't agree, if you want, you can add one line like this. Well, I'm sorry. Well, I'm sorry, which means you're saying that you don't agree with the parents' opinion. Well, I'm sorry. We get home for complete this mother to reduce any chance of infection. So what you're saying, what are you saying? You're saying that this daughter, her daughter should be from people with coughs and colds, and she should not be allowed for swimming for 3 weeks. So you're explaining some ways how further infection can be reduced. So this is the second subtask here, and then the third task is explore. Explore meaning find out any other parent's concern. Next steps meaning the next step she needs regarding the doubt she has. That is what is meant by here. Okay, so listen, I'm going to build up the sentence. So where did I end? The mother said that I want my daughter to go back to school tomorrow itself, isn't it? So you don't agree. So how do you say? Well, I'm sorry. She's advised 1 week of rest at home for complete recovery. I repeat, well, I'm sorry. She's advised 1 week of rest at home for complete recovery. Coming to the next task. I shall also reduce her risk of. I shall also explain some ways how to reduce her risk of infection. Then the brackets. She needs to avoid ചെയ്യേണ്ടതാണ്. Needs to avoid people have cough and cold and is strictly prohibited. Prohibited meaning not prohibited. If you find this word difficult, just forget it. I'll give you another word. And she is not allowed for swimming for the next 3 weeks. If you're using the word prohibited, how do you say? And strictly prohibited from swimming for 3 weeks. I'll repeat it, okay? She needs to avoid contact with people and swim for the next. Then coming to the next, explore. Explore meaning find out or confirming it like. Yeah. Then along with that, you can just say, I hope you're following. I hope you're following me. This is just a one-liner which you can add along with the dialogue. I hope you're following me. And the next, explore. Do you have any other concerns regarding her management or regarding her care? or it's fine if you just ask, do you have any other concern? That is enough. Students, did you all follow?
Yes, ma'am.
Yes.
Yeah. Then what is my answer? I'll say, okay, then can I know when my daughter should come for a checkup? That is my other doubt, okay? So you are also giving me that explanation. Someone read the last task.
Confirm no follow-up appointment necessary. Stress need for medical help if the daughter develops severe symptoms, example, fever, intense pain, prolonged bleeding from mouth, etc.
Thank you. So I'll ask, okay, when should I get my daughter again back to the hospital for a checkup? Then what is your answer? Confirm, meaning give assurance. Make it clear that no follow-up appointment is necessary. Why? Please use the explanation that is above in the first task, because her post-operative recovery is quite satisfactory, isn't it? Please use an explanation from the background or from the task whenever necessary to make it very clear. Then you can say stress. Stress meaning at the same time give importance and say need for medical help, that she requires medical help if in Malayalam adava, if the daughter develops severe symptoms like fever or intense pain, you can say all this. Then in such cases, she has to come back to the doctor. Okay. So where did the mother stop? The mother said, okay, when does my daughter need a follow-up? So you can say, regarding her follow-up, as I'm using the explanation in the brackets, okay? As her post-operative recovery is quite satisfactory, she does not require an appointment. She does not require a follow-up, if you want, you can say. However, use a linking word, adava, ennal. However, if your daughter experiences, you can use the symptoms. However, in case or if your daughter experiences fever, intense pain, or prolonged bleeding from mouth, definitely stress. It is here the word stress is used. So definitely you need to seek medical attention. You need to seek meaning get, SEEK. Seek medical attention or medical help. Now listen, see, now your task is over. Yes or no? Do you have any other task?
No, ma'am.
But I have one more task left, okay? It's very tricky. Students, please. So I'm going to say, see, can you read my task? Say you hope your daughter will be fine and she won't develop any serious symptoms. This is the concern of a mother that automatically comes out from her mouth, isn't it? As we all do. Malayalam will say, oh, that is how we say. Same way in English, I'll say, oh, well, I hope my daughter will be fine and she will not develop any serious symptoms. So when you look technically, there is no task here, but still it is very important to give a response. How do you all say?
Let's hope.
Let's hope for the best.
Definitely, let's hope for the best. Very good. At least you all remember. Okay, so this is very tricky. You have to give a beautiful answer, at least one line of reassurance again. Definitely, don't worry. Let's hope for the best. Or don't worry, I'm sure your daughter will be fine. You know, some one-liner like that. Okay, so now we've did the task beautifully. So how do you wind up? I told you should not give a sudden ending. Abrupt ending is not good. How do you wind up smoothly? Then you can ask, apart from these, not these, because we have asked a lot of questions, no? We have discussed a lot of things. Apart from these, do you have any other concerns? Then definitely they'll say, no, I don't have any other doubts. Then ended beautifully by saying, thank you. Please use a high pitch. Don't say, thank you. It's very dull. Say, thank you. And then end it. Okay? So I hope it was clear because I've said it very, 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 very slowly so that you all can write it down or whatever. But please, students, again, I'm telling you, don't say exactly the way I said. This is my style. And I want you all to, because you will not be comfortable in this. Because each one has their own level of English here. So I will not blame anyone, but instead, this is the essence. This is actually what you need to say, but you can use your own simple words to answer. Okay. Is that clear with everyone?
Yes, ma.
Yeah.
Yes, ma'am.
So can we have a quick role play session now? So I want to see one main request is there should not be any long pauses. Okay. Even if two people say together, don't bother. You all just start off. Let there be no gap when you talk. Okay. Now, so one of you start. You start and you can say till the first task.
How can I address the child during the role play?
Maria,
Good
say
afternoon.
thank you.
Thank you. Thank you. Good afternoon.
Good afternoon.
My name is Naseem Akhtar and I am the duty nurse today. Am I talking
Okay.
to Maria's mother?
Yes.
Okay.
Continue, Nas.
Thank you. Thank you for the information. Well, I have come with the glad news that your daughter is ready for discharge as her post-operative recovery is quite satisfactory.
Okay. Yeah. Someone else say continue.
Can I know any
Can I
other
continue?
concern about your child?
Can I know if there is any other concern? If add in, please add if. Yeah. Say Betty, continue.
Can I know if there any other concern about your child?
Use the bullet points. Regarding?
Regarding sore throat,
No. Regarding pain management or care after discharge. I think you joined late. So can one of you add to that? Can one of you repeat the same thing once again?
Could you
Can I
please
know?
tell me, do you have any concerns regarding your child's discharge? For example, related to pain management or self-care after the discharge?
Okay. Yeah, well, I'm a bit worried about my daughter's condition because she has a bad sore throat. And when she talks, she sounds as though she's speaking through her nose. Actually, these are all worrying me. So, what do I do about that? Next one.
Don't be upset.
Mini, continue. Who said don't be upset? Continue.
Don't be upset. We are here to help you. You said that
Okay.
your doctor had some sore throat and sound change. These are the common after effects after this surgery, and
Okay.
and there are some other side effects such as earache, stiff jaw, and change in voice, etc. So, nothing to be overly concerned. I shall recommend some pain medications like paracetamol, which is available in over the counter, and it will ease her pain. Okay, are you following me?
Okay. Yeah, definitely. I'll give her some paracetamol. But let me tell you something. So far, my daughter has only had hospital. So I would like to know when she can start eating proper solid food again. Can you tell me on that?
Regarding her time period for solid food, she can start solid after 3 days. In the meantime, you can give her something that is easy to swallow or that is something smooth texture and non-abrasive.
Okay. Yeah. Along with that, you can say, are you getting me? Are you following me? Okay,
Are
Vinny.
you getting me?
Yes, definitely I will follow your advice. But let me tell you, I want my daughter to go back to school tomorrow itself because I don't want her to be behind at school as she has missed a lot of classes. So, what do you say on that?
Well, I am sorry. She is advised 1 more week rest at home for complete recovery. I shall also
Okay.
explain how to reduce her risk of infection. Firstly, she need to avoid close contact with people who have cough, and cold. It is strictly prohibited from swimming for 3 weeks. I hope you are following me.
Okay, she is also strictly prohibited. Okay, she is also strictly prohibited, not it. Okay, good. Continue. Why did you stop? Can you just finish up the last task also? The last third.
Okay. Do you have any other concerns regarding your daughter's management?
Yeah, actually, I need to know when I should bring back my daughter to the hospital for a checkup. Can someone else address that?
Regarding her follow-up, as her post-operative recovery is quite satisfied. Quite
Quite satisfactory. Hello.
sorry, ma'am. I have some disturbance here.
Okay. So can someone take it up? Guli, where are you? I think she's on duty.
Am I saying?
Please. Yeah, please say. Asinta.
Regarding her follow-up visit, let me tell you, since the post-operative recovery has been satisfactory, she need not be brought up for the follow-up visit. However, let me tell you, she needs to seek medical.
Medical? It's breaking, Asinta. Say from the beginning once again. I think she doesn't have a good range there. Can another person take it up fast? From the beginning.
Regarding her follow-up, as her post-operative recovery is quite satisfactory, she does not require a follow-up visit. However,
Okay.
if your daughter experiences symptoms like fever, intense pain, prolonged bleeding from mouth, definitely you need to seek the medical attention immediately.
I hope you are following. Eh?
Okay, I hope you are following.
Yeah. Okay. Then my answer is, oh, definitely. But I hope my daughter will be fine and she will not develop any serious symptoms.
Definitely, don't worry. Let's hope for the best. Apart from
Okay.
these, do you have any other concern?
No, thank you. You've given me a very good explanation.
Thank you.
Thank you. That is the end of the role play.